Good afternoon. Good afternoon to everybody. Hello and welcome. You are tuned into Revive FM 94.0, where the heart of the Newham community beats. Don't forget to like, subscribe, and comment on our YouTube, Revive FM UK, and also follow us on our Facebook and Instagram under the same name. My name is Umar, and I am hosting our new show, Newham Talks, whereby we will be engaging with the local authority from where we do our show, which is Newham. And on a regular basis, we will be having the mayor, as we've had in the past, and councillors and hopefully council officers to speak about issues and initiatives that we are running in this wonderful borough that we all reside in. My guest needs no introduction. He has been here. I think it's your third or fourth occasion.
I think it may be 4 or 5. Yeah,
I
something
think
like that. I was working it out on the road.
I think we
like
need
that.
to get like a trophy for someone once they come in 4 or 5 times. So it's wonderful to have you on the show, Councillor Neil Wilson,
Thanks
who
for having
is
me. Thank you.
the Cabinet Member for Health and Adult Social Care in Newham. Councillor, if you could just, we've obviously spoken about this before, but we'll definitely be having new viewers coming in each time. What does your actual role entail?
Yeah, so it's a very wide brief given to me by the Mayor. It's called my portfolio. That covers public health, and we'll be talking about issues around that today, I understand. Public health, the interface with the NHS is clear in that sort of regard as well. So there's a public health team, which is the council services, our interface with the health service generally, more widely, everything from GP services right through to the hospitals, yeah, and everything in between, and all the structures that come with the health service and for governance. And then the very important issue of adult social care, taking a lot of resources from the council rightly towards our more vulnerable adults. People often think it's just adult elders, but it does include people with learning difficulties and disabilities and people with all sorts of medical needs, mental health needs within that gambit. And also I get other issues to talk about as well, which, just across council.
Fantastic. So specifically regarding today's show, we're talking about winter wellness.
Yes.
So could you go into a bit of detail what the strategy or mindset of the council is regarding this particular initiative?
Well, there's been research evidence to show that, and particularly it's true this particular winter, that the more vulnerable groups I've already mentioned are more susceptible to things like flu. We've got 4 times the figures already in London hospitals presenting than we had last year. So there's an important dimension around, which I'll be talking shortly about with you, I think, about vaccinations. But it's winter wellness in terms of trying to prevent people getting ill, but also once they have, to make certain, if they haven't had vaccines, that they'll be being assured of those. Because this is in the context of obviously an energy cost increase. I won't go into all the political factors on that, but there is an energy problem. And of course, a lot of our residents are having real issues with not just heating the homes, but also dealing with rents and things that we've talked about in the past. So it's about ensuring that when there's those pressures on from the climate, as it were, the colder weather, people are able to be assisted as far as we can to try and get through the winter without having serious illnesses.
Twofold question. How are you dealing with rolling out, obviously, vaccinations? Because there is an element of society where there is an skepticism, let's say, after COVID-19.
Yep.
And Newham's a very vast borough in terms of languages and cultures and creeds. Are we getting the message out to different communities in terms of languages as well?
Well, we're doing community clinics all around the borough, so whatever location people are finding, and the people who are eligible for vaccinations can either book at a location near them or attend as a walk-in at most locations anyway. Our vaccination program is quite wide-ranging, and we're actually investing within our partners, and particularly the GP practices are very good at this. I mean, I myself had a text, and I think people are getting used to getting a text reminding them that, there's a COVID vaccination ready, or they're their flu vaccination is ready. Now, by this time, I mean, those texts start appearing in people's on their phones at sort of, September, October onwards. But we're never complacent. So we've had vaccinations at all of our library services. We've had them at Dockside, where the council main officers are. But it's more an outreach program. And you rightly say, with our diversity, that we must get the messages across. So we've had very good cooperation from the Gurdwaras, the mosques and other places of religious worship, where communities can get the information in their languages and accessible. But there has been some skepticism over the past and some misinformation around vaccination. So we've always got to counter that.
Of course, yeah. Brilliant. So in terms of support, other than the GP clinics or other mobile clinics, are any of the libraries taking any initiatives in regards to this?
Yeah, because obviously the library service is actually very much in the community. We've got 10 locations across Newham. They have been acting as a hub for all sorts of things that we may talk about later on in relation to this winter wellness program. But they are not just, about dealing with the services, but they can be signposting where people are available, whether they're on site at that time, or they can actually say via people like myself and the other councillors who do their surgeries often in the libraries, that people who are housebound can request a home visit via their GP. And we've got high registration within our GPs, very good cooperation with them. But most people should be quite close to a pharmacy. And you may know that the central government have actually said that pharmacists will be taking on more and more of a role. I've had my flu jab myself sometimes at a GP clinic that's not mine, but is in the program, hence the text, but sometimes at the pharmacy. So I don't think people are worried where they get the jab, as long as we're concerned that they get it. So it could be the pharmacy, a GP clinic, or a community clinic. So the more access we can, we'll get better coverage.
Brilliant.
And the figures are quite respectable, but we should never be complacent.
Correct. So we've touched on obviously the vaccination aspect and encouraging people to go and take the vaccinations. Is there any other kind of strategy in mind for the council in terms of illness prevention or remaining healthy, or any kind of initiatives to remain healthy even in the winter months?
Yes, I mean, we've got a whole series of things about, how to keep warm, because there's quite often a correlation between, quite a strong relationship between people's heating and particularly respiratory infections.
Mhm.
They've been exacerbated by such things as COVID anyway. So people with COPD, and initials that I can never get the right name for, but basically it's a breathing thing. And asthma, obviously we've got issues around people who are, got respiratory infections. So it's not just flu, but, keeping your house warm is quite important. So we're very keen on making certain that people can look at how information can be available on the website to save energy, and the Keep Warm page, or those leaflets being produced around which are available in the library. You may know that in the library we've got sort of a rolling screen, and I think we've also had rolling screens at the Westfield site and on our rolling screens not far from the studio here.
Yeah,
the
around the
ad
corner, yeah.
show ones, or what they're called. And I think they're important messages. But the most important thing with all public health often is word of mouth. So somebody might go into the library and think, oh yes, I've had to text, I've had this reminder, I must go and get my vaccination. Or, somebody was saying the council was very helpful with some advice around, how to keep warm.
Brilliant.
So we can do leaflets, we can do messaging, but honestly, I think there's still the individual contact. And our library staff is superb at this, but also I think a lot of the officers, and when people go to their councillors, we're not there to give advice necessarily, but we can point them in the right direction where services are.
No doubt. I think If someone's had a good experience, they'll go and tell 10 people. And if they've had a bad
Exactly.
experience, they'll go and tell 20 people not to go and use the service there.
Exactly.
So I think
Oh, I get where you're coming from.
So
yeah.
I
So
think
we're looking at service quality all the time. And as I say, it's a bit like the vaccination rates. You should never be complacent. We can never be complacent. And we're in a relatively, well, one of the 6 or some richest countries in the world. But that doesn't mean that people have got equal access to services. And the very vulnerable, the very people who we must try to reach are often the ones who sadly we're not reaching, because either they've had bad experiences in the past, or they haven't heard about them, or they're frightened of what might happen if they do, go into a surgery.
sadly, I think it was a couple of years ago where we were in a situation where it was even in the headlines, heating or eating. Don't think we want to obviously go back to any kind of situation there. But again, you have to factor in there's a massive issue with cost of living in the United Kingdom at the moment. And the bills will be going up, the gas bills will be going up in the winter months as it gets colder. What kind of support is there available for vulnerable individuals where sadly there is a reality whether they can heat their home or they can feed their family?
Yeah, as you rightly say, it's an awful choice and an awful way of summing it up how some of the most vulnerable in our society heat or eat. And what is a choice, particularly if they've got young children within the home. The real disposable income, and I'm glad that we're now addressing both at central and local government ideas, and it's cross-party, this work, how, the cost of living actually is about real disposable income, because a high proportion, we've said this earlier on this program, but also when I've been on before, we have a high percentage of our people paying a lot of their income, which is limited to start with, in rent. So what is available then to heat the home, as well as to look after their families, or if they're single for that matter, to feed themselves. So we've got our Newham Money advisors, which offer help and support. That is a service that obviously is linked in with all sorts of things about claiming benefits. I think I've said before that we've got a really good relationship with our community and mental health service trust, where they're on a income maximisation, benefit maximisation program, and they've helped so far, I think, across all the boroughs they're in, not just Newham. Something like 50,000 people to maximise their benefit take up.
Where is this support available?
Well, through the Newham Money, through either the GP referral route, or through the other areas like our Newham Money have got the support and tips on saving money, basically about saving money on your food shopping, and it's available via the Well Newham website. We can't be coordinating all functions, but we can at least signpost people, whether it's our Newham Money or through the local NHS trust, to make certain that people are making certain, and there's a commitment by central government, that people get their maximum benefits. So often people have either a stigma about it, or they feel it's too bureaucratic or it's too complicated. And that's another role. I mean, I've said about 3 times already, but I'm bound to, aren't I? I've been on the council long enough that people come to us for advice, because housing is obviously one of the things that we do with most of our surgeries. We're trying to arm, and in the new year, make certain that councillors are aware of what's also available, particularly this around benefit maximisation. Because obviously the winter fuel, as you say, doesn't look as if it's going to be on a downward path. I think the tariff is going up a bit.
Yes.
People like me might be able to afford that, but it can mean quite a lot of difference for a lot of people who are already on very limited income.
Yeah, so someone that's maybe got £100 disposable income at the end of the month, if that £100 is going towards energy bills, then we've obviously got a massive problem there. Is there any kind of winter fuel payment scheme or anything available to anyone that's struggling? That's question number 1. And number 2, you mentioned obviously winter wellness and visiting their homepage. Is this available in various languages? Because people may struggle in the English language. Would this maybe be something to look into as well, maybe
Yeah,
to...
I mean, we've got a translation service, and we whatever production we have, particularly we keep discussing this at the local integrated care partnership board that I'm on, and that's a policy direction for all 7 boroughs in North East London. We may be struggling with finance, but that is about the hospital services mainly. People are struggling sometimes for us to actually get the more preventative work, and this is definitely preventative work. If we stop people developing flu or developing worse respiratory conditions by making certain that we access via their own languages, via their places of worship or their community networks. And sometimes people can get information, and I've seen this, at community centres when I've been visiting. It may be an information stall that we have at one of our events. And for instance, I was on last time, I think, about the Aging Well Festival. There was a tremendous take up there of vaccination programs, and people were getting information. I think you actually came yourself to that,
Of course.
where, that cross-fertilization model, as I call it. So we don't have people in white coats necessarily and having, if you like, a sort of clinical approach to life. But it should be a natural part of life that we're looking after mum and dad because they're in the category of the vulnerable adult. But what about the person who's sadly just living on their own or doesn't have that family support, or the family networks have moved away? It's important that they have that link either at their social club or their community, or drop in during the library. There was something I missed this morning, a Christmas event in Plaistow Library. But it's not just Christmas, obviously. That will go on every so often, the coffee mornings, the interactions. And I think then if we get people who are, and we've got obviously the 50 steps I've spoken about. We've got change makers working across. They're all volunteers. They're doing a lot. Sometimes they're professionals in their own right, but they're doing this on top of what else they're doing. They are very good advocates as well. So, I think it's a combination of what's available on the website, how we can make certain we use the voluntary community interfaith sector to actually reach as many people as possible, and 3, that we make certain that there's an accessible, non-patronising, easily understandable. So we're using more and more graphics, for instance.
Brilliant.
Another way of, and it's not about coping with language. I mean, some of the white Indigenous population have got very limited reading as well. And I speak as an ex-teacher. So we have to look at what we're producing, how it's produced. Is it really effective? And I think that's a constant check on ourselves. Because, obviously I'm set targets by the Mayor. So as a health service, we're bringing back targets more and more. It's about not just a percentage take up, but who is actually benefiting from these programs.
No, I commend actually the Newham Council and the associated websites. They're quite descriptive and quite informative. I've looked around at other local authorities and their websites are sparse in comparison. And then obviously I also commend the initiative of the Newham Council of the digital inclusion grant that they've done, because it's easy to say, Neil, just go onto the website and have a look. But a lot of people don't know how to maybe even get onto the internet. For me, just giving you a website, it's simple. You might be able to do it in 30 seconds. For somebody else, it's a lot difficult. So I think it's fantastic that something like that's being done as well to ensure that people know what is available to them online. So we've spoken about the support that's there, maybe financial support, or how the people can support themselves further. What about the kind of community or family support that's available?
Yeah, because we're all, I mean, I reckon that one of the things that's kept me in, I think I may have said this to you before, or people who are sitting in your seat interviewing me, that what keeps some of us in politics, and I've noticed that Brent has taken over as the most diverse in the latest statistic, but there's always that competition. If we've got 200 so languages spoken, if we've got that number of ethnic, racial groups, cultural groups, it is important that the community support is rooted in what we as politicians, and we are a very reflective group of politicians now, make certain, whether we're talking to the Black African community that has certain issues around their networks or the Asian community, whether it's the Muslim, the Hindu, the Sikh community, whether it's Bangladeshi versus, not versus, I shouldn't say versus, Bangladeshi or Pakistani. I better be careful, correct myself straight away on that one. I mean, when I say versus, it's not in antagonism like some sort of football match. I mean, it's where do we direct and what's the most effective? There's I think we've said before, there are some really good community support networks. And we need to be seen, whether it's the mayor or myself, we keep saying that we should get out more to actually not just encourage them. So it's not just about a top-down sort of strategy approach. So that is important because we're dealing with real issues of real poverty or real health issues. But it's about translating that with the very people who are doing tremendous amount of work within their own communities, and they need support. And that's why, you know, it's been volunteering week, I think, last week, and we've had some really good events there. And we've had, you know, there's nearly everything, nearly every day of the week of the year is somebody's week, you know. So we've had World AIDS Day, or we've had obesity, or we've had, you know, there's 16 days against violence against women and girls. All projects would have a health element, but also a community element, because we're moving fast away. And I think it's been a policy now for about 10 to 15 years, but certainly in the last 6 or 8 across local government in England, particularly, that we shouldn't be doing things to people, but with them.
With them, yes.
And because otherwise, there would always be people who you want to reach. And we shouldn't call them hard to reach. We need to reach them. It's like we have a conversation. We don't tell people what to do. We're in a democratic society. It's about encouragement. It's about making certain there's community. We've got family hubs as a program. We are trying to move towards more co-location, you know, bringing services together. And that is a wide door to go through, not necessarily delivering much at the moment, but still moving us towards with health partners. So
what's the location for these family hubs? What are the locations for these family hubs?
The family hubs are already in place, and we're developing those. There's another move to make what we call co-location. So in other words, with GP surgeries or with community centres. So if you have a community centre, we've got a program already, just as we have with employers. So employers are actually hosting some of the vaccination program, and that's quite unique. So in Westfield, we've got, you know, business partners offering workplace vaccination. If we had co-location throughout, which would be my ideal, people wouldn't be going from one thing to another. They'd be going to the family hub, or they'd be going to a neighbourhood model. And that's what central government are directing us towards with our local partners across the integrated care partnership, is behavioural teams, they're calling them neighbourhood teams. So to the lowest level, to develop the maximum amount of services, so that we don't have these awful hospital waiting lists, so we don't have a problem with people registering. It's part of the landscape. Yeah? Because I think we've established, you know, and I come from an education background, we've established the school as a focal point. Often the religious centre, whether it's a church, a Gurdwara, or the temple, or the mosque, are community centres. But it's about how does the local authority not duplicate some of that, but reinforce it. And the health service moves away, I think, from a more clinical approach to a community health point of view. And local authorities not just provide information, but actually can give a coordinating role. Yeah.
Collaborative approach.
Collaboration. Yeah, you've done the word for me.
Collaborative approach.
I like that. Yes, I like the word collaboration. Yeah. But we're pushing an open door with partners.
Of course.
This is in a time of restricted resources, but it's making us really examine how we can make co-location or integration of services. Because when we say integration of services, everybody thinks it's got to be about a building. It's not always that. It's about bringing the right people to where people are. Yeah. So, for instance, I think we've said before that on the Newham Food Alliance, we've got 40 voluntary community faith organisations all working to support residents either through the food banks or food clubs. That is a very important contribution to people on limited income. But there's information, for instance, there's one food bank that I went to, which was also dealing with the vitamin D rollout.
Oh, fantastic.
So, it's not just that you get food.
Mm-hmm.
And it's not just subliminal messaging. It's not, oh, while you're here, here's a leaflet.
Mm-hmm.
It's a real engagement. And I've seen that real engagement. Yes, I taught in Tower Hamlet, so I know the language spoken, but I'm not fluent in it. But those who can speak fluent Southeast Asian languages, for instance, can then make certain that people not just have the message about here's some food to help you with your budgeting, but there's the vitamin D that, or have you had your vaccination? And, remember there's a pop-up clinic coming around the corner. Yeah.
Fantastic, guys. We're going to go on to a short break. I'm very thankful for the wealth of knowledge that is being imparted towards us from Councillor Neil Wilson. We'll be back after these short messages where we'll be speaking about other aspects to focus on in terms of winter wellness. We'll see you after this short break. Take care.
Dear America.
Thinking about selling or letting your home? With Maxwell Estates, you don't need to look any further. Well established with over 15 years of experience, Maxwell Estates are specialists in residential sales and lettings. We manage over 200 properties in and around Northwest London, keeping our landlords and tenants updated with all the latest laws and legislations. Based in Edgware, our experienced specialist negotiators always ensure we maximize the full potential of your property. Call us now on 0208 952 0808 for a free no-obligation quotation, or visit our website www.maxwellestates.co.uk for further information. Maxwell Estates, the name you can trust.
With UK Export Finance, I'm fulfilling more export orders from around the world with working capital support.
Export insurance means I'll get paid when exporting to challenging markets.
At UK Export Finance, we believe no viable UK export should fail for lack of finance or insurance. Between 2023 and 2024, we provided £8.8 billion of government-backed trade finance to support UK exports. Learn how we could help you win export contracts, fulfill orders, and get paid. Search UK Export Finance today.
तकरीबन 60 मिलियन प्राइमरी स्कूल जाने वाले बच्चे इस वक्त स्कूल में दाखिल नहीं हैं। मयारी तालीम की फराहमी से पसमानदा बच्चों को गुर्बत के मुसलसल चक्कर से बचने का मुसावी मौका मिल सकता है। इस रमजान आइए आपके ताउन से इस बात को यकीनी बनाएं कि हर बच्चे को मयारी तालीम हासिल करने का मौका मिलेगा। मिनहाज वेलफेयर फाउंडेशन के जरिए बच्चे की तालीम को स्पॉन्सर करें। बस हमारे मकामी दफ्तर 12 कार रोड, नेल्सन, BB9 7JS पर तशरीफ लाएं। हमें 01282 723 455 पर कॉल करें या हमारी वेबसाइट www.minhajwelfare.org पर देखें। ताज़ा तरीन वीडियोस और अपडेट्स के लिए फेसबुक, इंस्टाग्राम और ट्विटर पर जुड़े रहें।
Nikah, talaq, counseling on matrimonial disputes, Islamic wills, Islamic law of inheritance, or an Islamic verdict on any other issue. The Muslim Sharia Council is at your service. We provide official certification, and our experienced and highly qualified imams are available to provide you with guidance when needed. MQI London is based at 292 to 296 Romford Road, Forest Gate. We are open from Monday to Friday 2 to 4 p.m. or alternatively call us now on 0208 257 1786.
अगर आप सोशल हाउसिंग में रहते हैं और कोई मसला हो तो शिकायत करने का तरीका जानें। मरहला 1, अपने लैंडलॉर्ड को बताएं। अगर ये फिर भी हल ना हो, मरहला 2, अपने लैंडलॉर्ड को शिकायत करें। और अगर आप उनके जवाब से खुश ना हो तो मरहला 3, हाउसिंग ओम्बड्समैन को शिकायत भेजें। वो इसकी मुनसिफाना तफ्तीश करेगा। एक महफूज घर का होना सबका हक है। अपने हुकूक जानें, मुलाहजा करें। gov.uk/social housing।
अस्सलामुअलैकुम। सर्दियों में फ्लू और कोविड-19 ज्यादा आसानी से फैलते हैं और आपको सख्त बीमारी का शिकार बना सकते हैं, मगर फ्लू और कोविड-19 की वैक्सीन बहुत बड़ा फर्क ला सकती हैं। ये आपको महफूज रखती है और बीमारी से बचने में बेहतर तरीके से मदद करती हैं। इसलिए अगर इन सर्दियों में आपको ये वायरसेस लगते भी हैं तो आपको हल्के सिम्टम्स होंगे और आप जल्द सेहतयाब हो जाएंगे और आपके हॉस्पिटल में दाखिल होने के चांसेस भी कम हो जाएंगे। अगर आप प्रेग्नेंट हैं या आपको कोई लंबी बीमारी है जैसे कि सांस की बीमारी या फिर लंग्स, किडनी, लिवर या कोई दूसरी बीमारी, या फिर आपका बच्चा 2 या 3 साल का है, तो आप अपनी एलिजिबिलिटी चेक करें और अपनी वैक्सीन nhs.uk/winter vaccination पर ऑनलाइन बुक करें। वैक्सीन हासिल कीजिए और अपने आप को मजबूत कीजिए। शुक्रिया।
Revive FM
94.0 on the radio
on your mobile.
and online.
Good afternoon. Thank you very much. We are back after the break. Thankful again to Councillor Newham, who is down speaking to us on a whole host of initiatives that are taking place within the Council of Newham to tackle the winter itself and ensure that there's winter wellness accessible and available to everyone. Councillor, I'd like to get into a question which may have been a taboo thing 15, 20 years ago, but I'm very, very thankful that we give it the importance and the credence now, which is mental health. People used to just keep things locked up, but I think we've evolved as a society where people are starting to open up, which is fantastic. But again, in the winter months when it gets dark, I think you've come when it's light, and when you're going to be leaving this interview, it's going to be pitch dark. So it gets dark at 4:30. Long winter nights, isolation, loneliness is a factor. What kind of initiatives or programs do we have in place to tackle these kind of things?
Yeah, I'm pleased that you started off with saying that we're moving to a more open discussion on mental health issues. The winter, as you rightly says, is a challenging time for people. The council has once again made all the libraries, and we've got 10 sites across the borough. They're open to warm havens, so people can visit, they can take advantage of the library services that we've already mentioned, and they get a cup of tea and meet other residents. The important thing is that no one's alone, and mental health affects us all.
Mm-hmm.
We all have mental health as well as physical health. And so the messaging I think that people get is that there is a place which is a haven, and the word haven means place of safety, place of support, a warm haven, and that can help to their eating costs as much as anything else. But also in terms of mental health, a listening ear, somebody to actually where they can just offload or just be themselves and not be in a cold environment, cold in terms of either physical temperature, but also emotional support.
Do you have any kind of statistics of how many people are actually taking part in this? Because
no, we've only just, sorry to interrupt, but we've only just started, and I don't want to misdirect your audience here. I mean, we did a recent interview where the librarian that day, in just one of them at East Ham, was saying we're about 40 residents. Well, that was, it depends very much on what time of the day, what else is happening within the calendar. So, at the moment there's Christmas shopping and people may come into East Ham, though it's not Westfield or whatever, and where their shopping is. But also, more importantly, we do have obviously a severe weather, which I think we're going to come on to talk about, where people are given other provision. This is a community approach. There's also around 20 voluntary sector groups around the borough taking part in the community hot meal programme this year. So it's not just a warm haven there, it's about overcoming social isolation, providing hot meals, and a very important conversation. Because part of the issue, from all my reading and all my understanding, is that a problem shared is a problem halved and all of that. It's a listening ear. It's about, we need to talk about our mental health, but we also have to be good listeners.
Totally. I would encourage, because people to actually avail this service. I think there is that element of hesitancy that I'm going to go to somewhere where I might be a bit vulnerable. I don't know the people there, but it's a fantastic service whereby you're countering that isolation. It's better that you go and seek some kind of support and some kind of human interaction rather than obviously isolating yourself away at home or in your property. What would you say?
Just an example of that hot meals program. Most of those are sit-down communal meals. I would argue as a teacher that not enough young people actually have sit-down meals with their parents and other siblings, where conversation is part of it and the mobiles are turned off. But it's even more important if we're providing sit-down communal meals. If they're open at weekends, most of them are at weekends and evenings, that is so much warmer in all sorts of ways. I say it's not just the temperature, not just the environment, it's a supportive environment and a place where people can be, not always talking as much as I do, but having a conversation, as you say, breaking down barriers, sometimes that we erect within our own minds.
So other than the 10 locations at the library, is there any other locations that this is being...
the voluntary sector groups are not library based, so they sometimes come into the library to use our facilities, but they are dotted around the borough in terms of the hot meal programme. And that is another initiative, and there's been that has been going on for quite some time since I've been in Newham. But it's not, a load of that is voluntary work, and it's really important that we stress that without those volunteers, people's ability to access those services wouldn't be there. So it's sit-down communal meals. It is basically open at evening and weekends, but it's a strength of our community that is, again, looking after each other. It's an important mental health issue.
And all this information is obviously available on the website.
Yep, and there's several projects available, like chatty cafes. You can tell I would be quite good in a chatty cafe, but there's the Men in Sheds initiative, where men particularly are disproportionate effects of mental health issues. The Men in Sheds, last time I spoke to them, it was in a warm environment at Chargeable Lane, our adult social care facility, but those sheds are certainly well used, and men can just come in, get together and tackle their loneliness. Yeah. And it's not branded, if you like, this is a loneliness session, because I think the branding of it, the importance is that it's men coming together in order to share and the wider part of what we call our Be Connected program. All of this is available on our website, and it's very important that we get the message across.
No, I agree with you there. Sometimes just subtle messaging is a lot better than just being very overt with your messaging, which can be a bit off-putting for even the person that's trying to avail that service. We've spoken obviously about the warm havens, which is fantastic. We've spoken about the mental health and tackling isolation and coming together in these warm havens. Not only gives you that kind of companionship, which is important, but obviously Councillor Neil's spoken about the warm meals as well. I'd like to move on to what the council has strategized in terms of emergency and winter preparedness. Is there anything that our viewers, our listeners should be wary of that is of a worry or concern for the council, which we should be aware of?
Every time the temperature is below zero, the Greater London Authority, the regional authority under the Mayor of London, it triggers what we call SWEP, as a sort of shorthand. That's a severe weather emergency protocol. Okay. So all of us are responsible for rough sleepers. They're all our citizens. Mm-hmm. When the temperature hits 0 degrees or below, we've got our outreach team. We're in a commissioned relationship with Change Grow Live, really important workers, some of whom have had experience of this for years through St Mungo's and other charitable sectors. We open emergency shelters, and we've got currently 2, and we're looking to expand that provision with other funding. That's not just about Newham Council. And we carry out enhanced outreach work to support our rough sleepers. I go out on a count every other month with the team. And I think it's important that whether it's me or the director we've had directors come out as well. The Mayor is trying to join us with a heavy programme in the new year, that we make certain that if we've got emergency and winter preparedness, we've got the facilities in place. There's no good at having an emergency protocol and saying, oh, you've got to get off the streets because it's too cold, without the facilities for people to go to. So the last time I was out, it was a very cold night. And so I was wrapped up, but you can imagine what it was like outside Stratford near the church for somebody, with a sleeping bag here, and we, made certain that person was with their consent, because obviously it's a consensual thing. We try to work with people. Some people are very nervous about provisions that may, be not what they were thinking. But our outreach team would, if there was somebody there who was not cooperating, as it were, with the idea of going in, we don't give up. We keep going back and trying to see how well they are. The outreach team goes out at 5 a.m. We finished our count at 3. So, people aren't left alone. Support for rough sleepers is a pathway, and we are dealing with, lower numbers, but we, again, like I've said throughout, I think, it comes under me politically as a target, by the way. It's a corporate target to make certain that not just during the emergency winter program, but throughout the year, our rough sleeper figures are very low. But that's a lot of partnership working.
That was my next question, whereby if we're doing all these provisions in the winter, and if they sadly end up on the street again once spring comes, is it not just a vicious circle that we're going to be just going round and round, whereby we're just looking for some kind of provision in place for them over the winter period, but there's nothing in terms of real support for them over with the other
we
seasons?
have got a pathway. We're very keen on calling it a rough sleeper pathway. We have moved over 1,500, I think, since this initiative, away from being street homeless.
Mm-hmm.
But that's obviously in connection with the homeless prevention service. It's the rough sleeper service. It's Change Grow Live. But there are some people who we have to engage with. Remember, they also, because it touches on all the issues we've talked about before, people who may have some mental health illness problems with mental illness, problems with drug and alcohol addiction. So it's not a straightforward group of people we're talking about. But that doesn't mean to say that we give up. I think our team does a tremendous job in order to make certain that our figures are low, but people are supported. And it certainly doesn't stop when the temperature goes above 0 again. So the emergency one is really important to get people off the streets, to get, like we did in COVID, everybody in, But the important thing is that it's a response that's emergency and winter preparedness, because temperatures at night can fall really drastically, even in London. So to try to get that. But throughout the year, we are moving always people on, moving them to where we feel they're more safe, where there is support through hostel provision or other accommodation.
I'm just about to come to a close into the last 10 minutes of the show. As I always say to Councillor Neil Wilson, whenever he comes in, the time does tend to fly. In terms of the project, we're speaking about winter wellness. Is there any kind of feedback that you've received thus far since you've started this?
Well, there's a lot of information about what people can do for themselves and others on this Newham website, and that's been well received. And, that's clearly www.wellnewham.org.uk/winter wellness. I need to plug that because I think it's important. There's a lot of work gone through our comms and public health team to make certain it's up to date. So it's really important to share the information about how to stay healthy and well during the winter months with friends, family and neighbours. People laugh at, I always say on the X feed, please share with all your networks, whether it's on Instagram. We're in a society where people are communicating on text or whatever. The colder months can also lead to some people being isolated because they don't go out as much, because they're frightened of falling if they're, but particularly the elderly. So checking in with each other is just as important. It can make a big difference. If we haven't seen our neighbours, just knocking on the door without being intrusive. If we know them, we're just checking in. And for those who are less able to get out, people might be able to help to collect some shopping or prescriptions. 2 things that I know people are often worried about because they're frightened if there's it's cold outside, how are we going to get my shopping in? How are we going to get prescriptions? We've often received positive feedback from residents at all our outreach events. Every event, whether it's an event that the mayor attends or any of people like myself on cabinet, we always ask for feedback because we want to improve. So our Stoptober sessions, in other words, like the drive to reduce tobacco,
Smoking.
or the recent 16 days of action that I referred to, violence against women and girls, all of those figures will be collated. And, I was on a meeting earlier on about play strategy. That's something else that comes under me, by the way. And we both asked, me and my cabinet colleague for children, asked what's going to happen with the survey, how many people. So we do get feedback, and it's not just numbers, it's about the quality of the service provision or what is a real issue that we might be able to improve. Yeah.
Lovely. If somebody wanted to give feedback or avail the service once they've to give feedback once they've availed the service, is that the best way to do that is to go through the website? I'm assuming there must be feedback forms, etc. available.
Yeah. There's always feedback forms at the events.
Okay.
And it's important, I think, because then often people need help with, what sort of feedback do we want, And the idea of feedback is to make certain it's quality improvement, quality assurance. It's not just the numbers coming through the door. And we do ask such basic questions about, how many people from different age groups or ethnicities. They're important. But it's also about the quality of what the information is.
Again, I'd reiterate here is in terms of the feedback, if that could be in various languages, that would go a long way. Some people just, obviously, when English isn't their first language, they might just feel a bit intimidated in filling in a feedback form. Maybe a bit more forthcoming if it's in their own language. They could be a bit more expressive, I guess. On to last couple of final questions. We don't want to. How would I pose this to yourself? You don't want to be changing the strategy on a yearly basis. You'd want to do something that's future-proofing or paving the way towards the future. Is there a long-term strategy of how we're going to future-proof against the winters? Because honestly, it seems like it's getting colder every year. Yeah. I don't know if there's any element of truth in that, but it does feel like it's getting colder.
We, along with all other local authorities, have to have a corporate plan that is based on the priorities set by the electorate, basically, because we stand on a manifesto. It then gets translated into a corporate plan, and that's set around key principles, and we consider those elements and others to ensure residents are prioritised. So, one strapline we had in the past, which was very effective, was putting people at the heart of everything we do. We haven't moved away from that. We're just using other symbolism of that people-centred resident focus. So how do we make certain that we, with health partners and the community and voluntary faith sector, have a proper, if you like, future-proofing against winter wellness, against winter sickness, and a winter wellness strategy that is sustainable? Well, obviously, we need to respond to the climate emergency, and I think you mentioned that by saying about winter's good. I think the analysis is that it's about global warming, but there's an effect in terms of other seasons like winter. But preventable approaches that elevate health, well-being and happiness. We had a whole council meeting dedicated to that theme that both Roxana and I spoke about, because there's a lot of research that health and well-being and people's sense of content and happiness are all interlinked. I mean, the negative is if you're in poor health, you're feeling a cost of living, you're struggling with, your finances, that can have a real detrimental effect, not just on mental health, as we said, but also quite clearly physical health often. So that is in the key part of the 50 Steps agenda, which is owned by the Newham Health and Wellbeing Board, which is a board shared by the Mayor, and I'm on it, with other partners from the doctors, the primary care, all the other arms of the health service are there. And also in Health Watch, by the way. So Health Watch look at what we're doing, because they're the resident facing. They do another survey on what our provision is, and that's important. So delivering an inclusive economy, inclusive. So that means that it's a commitment to community wealth building. So whether it's a small and medium enterprise here in Forest Gate, whether it's in my ward in Plaistow in terms of some work with business startups, it's about local employment, putting that at the heart, because there's a link obviously between employment and people's wealth, disposable income, not wealth. If we say wealth, people think I'm talking about mega bucks in pay packet. I'm just talking about their income. Investing in young people, which is another key one. We had a really young population. We've still got a really young population. Tower Hamlets, I think, has overtaken us as the youngest in the boroughs of the London area.
London.
But we've got an increasing proportion of elderly people as well. And I talked about that with the Aging Well initiative when I was on your programme last. Wanting the best for communities so they can feel safe and clean within their neighbourhood. And, you know, there's a clear reference to clearing the streets, making certain that, you know, we have a proper enforcement around food standards, hygiene standards within shops and restaurants or takeaways, or, you know, just a disposal of rubbish with health related issues, and involving our residents in decision making. It's not just a once in 4 years exercise. We are proud of the way that we make certain that there's community involvement. I think we need to always examine, is it the most effective way of consulting people? Is it the most effective way of doing some community work building or people powered initiatives around their own projects within their own neighbourhoods? And finally, transforming the council, which is what I'm spending most of my time doing with the mayor and the officers, to make certain it's fit for purpose for the century. It keeps me in politics, it keeps us driving, but we have to continually adapt to make certain that we transform the council in terms of how it can operate for the best of our residents. Because after all, we're servants of the people. That's why we volunteered to be elected.
And that's the end of the hour, the end of the show. I'm very, very thankful, Councillor Neil Wilson, Cabinet Member for Health and Adult Social Care. We've spoken about a lot of things, a lot to digest. We did get the website on, so it's wellnewham.org.uk. You can see that ticker at the bottom of your screen. As promised, when we do get Neil on next time, we will need to have some kind of gift or something to give to him, as he is a regular contributor towards the radio station. I want to thank all our listeners and our viewers across our social media. Remember to like, comment and subscribe on our YouTube page and our Facebook and Instagram pages as well. The information provided here, as mentioned, wellnewham.org.uk. You should use the Newham website. It's a fantastic resource which will get you to the relevant areas that you may be searching for. Once again, thank you to my guests. Have a great day, and until next time, it's been your host Omar, and keep it locked on Revive FM 94.0. Take care. Bye-bye.
Thank you.